Breastfeeding shouldn't hurt. It's all you will hear day in and day out at the hospital because the nurses are trying to encourage you. And although it is good encouragement, it does almost discourage you at the same time if you're someone like me who did have a lot of pain when trying to nurse. So today I thought I would share with you some tips and tricks that I learned along the way of my breastfeeding journey, and I hope they help you out as well. So let's get into them. Number one is Nipple Cream. This is something that I'm sure a lot of you know about, and it is really a lifesaver. I promise you won't regret using this or any form of it. It doesn't have to be a certain brand. It helps prevent and treat sore nipples. So you just rub a little onto your breast, nipple area, and even if you prefer not to use this or you're out of this, you can use your own breast milk that also has a lot of healing factors in it. And this is just used to help heal the area and also for further protection. You do not have to clean the nipple cream off before you breastfeed. It is safe for you and your baby. Next is only use cotton nursing bras or no bra. You want to do this in order for your skin to be able to breathe and heal. And try your best to avoid scratchy materials in your bras and your clothing. I found that cotton and jersey knit were some of the most comfortable fabrics to work with. So you want to use nursing pads to avoid moisture building up, because that can cause bacteria to grow, and that could in turn cause things like, for example, thrush, and you do not want that to happen. It can also cause mastitis, I believe, in some situations. So this is a good preventative form, and it also helps you from not like having giant milk stains on your clothes. I wanted to show you, this is a disposable one. You just open it down the middle, and it's just like that. It's just cotton, and there's little stickies on the back, and you just kind of like stick it right into your bra, and this will hold like a cup onto you, and it will you know, wake away the moisture. But I actually did not love the disposable ones because as soon as they got wet, they would dry really quickly, which is great, but they also would, as soon as they dried, they become super scratchy. My mom actually got me these reusable cotton, what are they? I guess they're cotton, reusable pads. They're like a little cloth, and you can just wash them in the washing machine like, you know, your underwear and bras. And I remember when she gave it to me, I secretly was like, that's the grossest thing. Like, why would you, why? And then the time came and I was actually out of my disposable ones, and I hated wearing them because they were always so itchy to me. But I just had run out of them. So I needed some, so I went and grabbed these to try them. Loved them. Number one, like, you don't have to keep buying. It's a one-time purchase. And number two, they're so much softer, so they never became scratchy. Like, they were a lot more comfortable in so many different ways. So I would highly recommend, if you are especially struggling with the very sensitive nipples, especially to clothing and such, I would really, really recommend the reusable nursing pads. Next, I want to talk about two things that I didn't know of and didn't have when I was breastfeeding in the beginning, and I would have loved them. They would have saved me so much pain, and they are breast shells and hydrogel pads. So let's talk about breast shells first. They kind of suction on to your nipple area, and they also have holes for ventilation. Like we said with cotton, everything needs to be breathable so that you have the chance to heal if there are maybe some cracks, or if you're, you know, it's just a sensitive area. So anyways, it has some holes in it for ventilation, and it just kind of blocks your clothing and such from rubbing on it, which was a big issue while I was at the hospital. The hospital gown was so itchy to me. I didn't even realize that was what was causing a lot of the problems. So as soon as I changed into my jersey knit gown that I brought with me instead of the hospital gown that was really scratchy, then things went uphill from there. I started to realize, you know, oh, I'm really sensitive to clothing and touches in between feedings. So I would have benefited so much from these breast gels. So someone out there I know will benefit as well, and I will be using them next time for sure. And also the Hydrogel pads. They are a quick fix, kind of like, the padsicles that everyone talks about after you've given birth vaginally. You'll wear them and they really soothe and heal. That's kind of the same thing that a hydrogel pad will do to your nipple area. So in short, they give instant cooling relief, and they also really encourage the healing process. So nipple shields are a great option, especially if your nipples are starting to really dry out and crack, which is awful. It's so awful. And so that really can help stop it from getting worse. And even if it might happen soon, you can use those before it even happens, the cracking and such. So on top of that, it just helps reduce pain, especially in the learning process. I used them while I was learning in the hospital, and I think it helped a lot. But I would say to use them only if you absolutely have to, only if there's like real pain and that is helping, or if you are beginning to crack and especially bleed, then those are a must. But I would avoid them until you actually absolutely need them. And I only say that because they can really become a crutch. I know of a friend who she used them almost throughout her entire nursing experience. And although it's fine and it worked for her and maybe it had to happen, if it doesn't have to happen, that makes your experience a lot more simple and easier to just, whip it out and do it instead of like, oh no, where's my little shield? And so the more simple you can make things and just, tough through it in the beginning, the better, I promise. Let's see. And the last product or tool is an electric pump or even a hand pump, which I have stowed away my electric pump for now, but my hand pump I have with me. It's called a Haka. I 1000% recommend the Haka. It's so cheap, it's amazing, and it can catch your letdown on the other side, because as you're nursing on one side, you'll have milk just leaking out, which we call letdown, on the other side, and this can catch it so you can save it and also save yourself a mess on your clothes and such. So it's fabulous. Pumping is always a great, especially quick relief option from engorgement in particular. Now you can do that with, like I said, with a hand pump or an electric pump. Either way, you get to keep that breast milk, and breast milk is such an amazing liquid gold because you can use it for so many things. You can use it on your baby's diaper rash. You can use it on your nipples, like I said earlier, to help with the healing process. It just has so many wonderful things in it, and so many healing components. So you can also put it on a cut or scrape that your baby might get, and of course you can always use it to feed them with bottle feeding later if you would like to do that, and so on. It's just always a great thing to have on hand if you do have enough to spare, saving. So if you are pumping to help your engorgement go away, just remember that you want to pump for just very minimal, like maybe 5 minutes max on both sides, just so that you're getting, that little bit out to have some relief. You don't want to fully pump, otherwise your breast milk is supply and demand. So if you take a bunch out, you will replenish a bunch again. So it's tricky. Breastfeeding is quite a learning experience, but I promise you will master it very, very quickly, I promise. It's very normal, and the first few times that you won't get any milk or you won't get much milk at all, you can feel it, and it's like super hard and so uncomfortable, but just know it's normal. The first few times you might not get any out, but sometimes you will. So it's different for everybody, but don't feel discouraged in this process. You're doing great. Although you can't store the milk, the best way to avoid mastitis and getting engorged is to nurse. Now, at least you're not wasting the milk. Your baby's getting that milk, and that's the most important person who should be getting that milk. So, whatever. But nursing is the most effective way to avoid a lot of problems, if you have already started nursing, that is. But if you are finding yourself to be engorged often, or you can tell that you have quite a bit of an oversupply, and your milk is becoming very steady, but you just have too much almost all the time and is very uncomfortable, one thing you can do is you can place cold cabbage leaves in your bra onto your breast area for just a few minutes. I think that what they say is just until the cold cabbage becomes warm again. And that will actually, I don't know, it has some crazy situation. I don't really know if anyone knows why it works scientifically. I'm sure someone does, but I don't. And that will somehow make your supply regulate where you're not oversupplying. It worked for me and it was great. But anyways, if you don't want to do that and you want to wait until it just figures it out on its own, then all you need to do to help that pain is to use a warm compress, or you can always go and take a warm shower. The most effective way to avoid pain is by perfecting the latch at the hospital while you have their help and their guidance. In my experience, I finally realized a big issue I had on top of some other issues was that I was holding my breath as I was nursing because I was nervous. It scared me for some reason. I wasn't comfortable. And so I want you to remember to breathe while you nurse, because if you forget to breathe, pain can always feel worse than it really is. So just remember to breathe. So throughout your entire nursing experience, you will have knots, throughout your breast here and there that are actually just pockets of milk. So as you're nursing, to relieve that pain, because sometimes the knots can be uncomfortable. So to release that pain, all you want to do while you're nursing, or even while you're pumping, whichever one you're doing, you will push on that knot and it'll release that milk quicker within the feeding session and you will get that relief. But if you do that, it doesn't work, or it doesn't get out as much as you need within the time of the feeding and so on, you can go and take a warm shower. And warm showers really are magical. I learned that when I was laboring and I went and took a hot shower, and it's amazing what hydrotherapy, I guess is what it would be called, can do for you. So do that. If you're going into labor, you haven't started nursing yet, and you're watching this before just to learn, then good for you, for one. But number two, if you're trying to go as long as you can without pain relief or whatever, go take a hot shower. It's amazing. Speaking of showers, try your best to shower every day, and remember not to use soap on your nipple area, because soap can actually dry out that area and cause cracked nipples to become easier to get. And on top of that, hot water can sometimes do that as well. So really focus on just a warm shower and really just, wetting down that area, not really soaping it up. The last 3 things I would like to share with you are just some general nursing tips that I think are so simple but so important. There was a point early on in my nursing experience where my supply actually dropped significantly, not all the way, but a lot to notice, and it was really scary. But I did 3 things that I swear are magical and will help so much. Are to drink more water, rest when you can, and look at your baby when you're nursing instead of your phone. And I swear that last one was magic. Give it a try. No harm in it. I hope all this information helps. You are an amazing mother. You're doing great. Keep it up and work through the pain. You will get past it, I promise. But anyways, thanks for watching, and I will see you next time. Bye!